Hey Paul, can you explain what DFR is?
DFR stands for Dermal-Fascial Restoration, and what it is a manual therapy that can very precisely identify limitations of slide and glide and elongation of the skin and the fascial tissues. Not only can we identify them, we can actually use our hands and very precisely manipulate this tissue without harming it and restore the health of the dermal fascial tissue quite rapidly, which impacts the function of the muscle system, the joint system, the nerve system, the lymphatic system, all these things that are interconnected. And we've basically been ignoring the skin, which is a huge interconnection between the fascial system. And it's very difficult to get great results rapidly if you don't address the skin as well as the fascial tissue.
Surgery. I'm now 8.5 to 9 months post-op. I've been having to kind of offset practices to compensate for my inability to use my left shoulder as much as I can as my right. Well, therapy, of course, was strengthening, using bungee cords, weights, balls. I've done pretty much any method you could possibly imagine, and yet it's still not as strong as my right.
17.5 pounds. Just go ahead and try and do a lift there.
That's it.
Yeah, but yet it's just stuck like super glue in here. Good thing is once we break it loose, it should stay loose.
That's nuts.
Okay, just release now and spend about a half hour working over the biceps and the deltoid area. Justin, go ahead and raise your arm and just tell me what you're noticing different.
First thing I noticed is when I did this before, like I said, the few degrees of range of motion were still a little painful, and kind of had like an internal kind of a pain, an internal pain in it, and I just got off the table and did this the first time, and actually there's no pain. This is smooth. I don't have, and I normally do, have kind of a thing that, as you feel the bands of muscle kind of tightens roll over, but it's not. It's actually smooth. It feels pretty good.
This infraspinatus is what does that external rotation, the one that you were doing on your side there, with
Really?
the primary muscle for that particular motion.
It's all deep burning.
Burning again? Good, that's the fascia. Did about an hour's work on the posterior shoulder girdle.
It's amazing. I feel I can open the joint a lot more. I mean, I'm starting to get tired, but I couldn't even do one before.
It's at ease to open up and kind of hit those extreme positions without having to fight it, without extra pain, kind of definitely through the biceps tendon. It felt significantly easier than it has been, so thank you.
Maybe 3 or 4 years ago, rear-ended on a highway, and then about a year and a half later, working at a different job, and lifting the 4-person lift. That's when I just could barely move.
Well, most of the time we think of adhesion, we think of it like around a nerve root, affecting the deeper tissues. I personally think a lot of the reason why the muscles don't fire is because they have the adhesions.
Yeah.
And you release the adhesions, then the muscles fire. Then you can re-educate it a lot easier.
The muscle's active now.
See, what's happening is before it was all glued together,
Right.
and the
Now
muscle fibers couldn't shorten.
Right. And now,
Now
it's
they're
like
able
it's
to
doing
shorten.
it. And it's like never done it. So it kind of feels like that. Huh. Wow.
If we release this, you wouldn't feel like you'd be able to even sit like that?
No, because I can barely sit. I would never have done that. Because it used to be with a drop. Like a lot. Wow. Oh. Yeah, I couldn't do one before. Rotation.
Uh-huh.
And then I can get down. It's just real tired. I could get down on this one.
Uh-huh.
And then this coming up and switching,
Yeah.
I couldn't do at all.
This is our 8th treatment session, and we're going to retest the 90-90 leg position. Go ahead and try and straighten it. I kind of move this around a little bit and see what it moves like.
Alright. Yeah, there's more of a burn there in the middle. Yeah, not as tight. Yeah, it's better. Yeah, loose. Feels balanced.
It's right there.
Oh, yeah, there I feel it. Yeah, it's good.
I was rear-ended. I was completely stopped. There were 3 other cars behind me that didn't stop. Tight. And I could hear it crackling in my neck.
That's not quite 40 degrees.
And we just measured about 74 degrees. How's that feel?
Fine. Doesn't hurt. It's amazing. When I drive a car and I have to look in the other lane, I'd have to move half my body. Now all I have to do is move my head. I don't feel like my shoulders are hunched in and my neck is crunched down and stuck in one position. I feel free.
Normally been close to the wall, and just leaning into the wall about like this would have been about it. And I would, like I said, I felt like it was fused, like I couldn't move it.
Yeah.
Now, I mean, it's absolutely amazing. It's like I've got a hinge on the side of my hip.
You're starting to feel normal again.
Yeah, beyond normal.
Thyroid surgery done ended up with a closed vocal cord.
Paralyzed my right vocal cord.
But she's got a lot of scar tissue.
Months ago, I was at church and I haven't been able to sing since I became ill. In service, my voice just like came really, really strong and surprised me. I've been able to sing since then.
Tongue cancer, the base of the tongue, and they took out several lymph nodes afterwards. The scar, I don't even notice it. It's so, I don't even feel it at all. I think I felt it at the time you were releasing it, that immediately when I walked out the door I could feel that it was just regular skin. I could notice that I could really move a lot easier. In fact, I wondered myself how many people went through that and then lived with a real tight neck the rest of their life. And I thought, gosh, everybody should know about that.